Coming to our clinic is just like going to a regular doctor's office. First, I start by greeting the patient. Then I take you back to a room to talk about your sexual health. Many people are not comfortable talking about sexual health, so I do my best to try to make them as comfortable as possible. There is a lot of misinformation out there, and I love what I do because I can help change that for teens and young adults. Hi Cindy, I'm Jessica. I'm the provider here. Hi. Nice to meet you. So, how long have you been with your boyfriend?
Almost a year.
Wow, a year is a really long time. Have you guys thought about having sex, or have you had sex yet?
We haven't had sex. I've given oral sex a few times.
Okay. Did you know that oral sex is still considered to be sex?
That's not what my friends told me.
Yeah, so there's a lot of misinformation out there about what sex is and what it's not. So that's why I'm so glad you came here today. Our staff is trained to specifically answer questions such as these. Vaginal, oral, and anal sex are all considered still to be sex, and they can all transmit STDs. Once I have all of the patient's sexual history, I go over with them whether they may or may not be experiencing symptoms related to an STD. I also educate with them that many STDs don't have any symptoms at all. I would like to do further testing to see if you have an STD.
Will the test hurt?
No, not at all. Many times it's as simple as just giving us a urine sample, but sometimes we do blood work or a vaginal or throat swab. Today I'm just going to do a throat swab. When doing a physical exam, I examine the area of the patient that they may be experiencing symptoms. I first start out by looking in the mouth and throat. If a patient is experiencing symptoms in the genital area and it is okay with the patient, I look in that area for sores, rashes, or discharge. I also may do a vaginal exam or abdominal exam as well. So this test takes about 7 to 10 days to come back. Some tests we do here come back immediately, but this one does take about a week. Okay. So Cindy, we got your test results back and you do test positive for an STD. So we can treat that today here in the office with antibiotics, but I do recommend that you talk with your boyfriend about this. It's very important that he come in to be tested and treated as well, so then you guys aren't spreading the infection back and forth or to future partners. Are you able to talk to your parents about this?
They're going to kill me.
So although I recommend that you do talk with your parents about this, it's completely your choice. If you're scared how your mom or boyfriend are going to react, we can contact them for you. And although I do encourage you to talk with your parents about this, it's completely your choice. We'll only contact them if you want us to. You're doing the right thing and taking the correct steps in preventing the spread of this infection and protecting yourself.
It's been really difficult coping with finding out that I have an STD. We all make mistakes in life. The important thing is to learn from them. Even though my parents were super disappointed, they understand that it's more important to fix the problem than to ignore it. They were glad that I felt safe enough to talk to them about it. It's not scary now that I know, and I'm going to make sure to be smart about sex in the future.
I'm Misty. I'm the Education and Outreach Coordinator for Choice Family Healthcare. Because I am out in the community a lot, people trust me to talk to me about sex and STDs. I give them the facts about detection, prevention, and treatment. Most STDs, if caught early enough, can be treated with antibiotics. Most teens and young adults just want to know where to go and who to see if they think that they've got something. I think that the most important thing that we can teach is prevention, because if that's done right, we don't have to worry about the detection and the treatment. Regular testing should be done if you are sexually active, because not everyone has symptoms. Abstinence is the only way to not contract an STD, but as we know, young people are having sex and need to be educated and need to be using condoms every time. Using birth control without condoms may keep you from getting pregnant. However, it does not protect you from STDs. Our community is extremely lucky to have a place where teens and young adults can come to receive reproductive health care services at little to no cost to them.